okay, interesting. So I grew up being the most caring in the family, given I'm the only girl. So I look after my sibling, of course also the parents. And going to school days, I was surrounded by music and mathematics. I thought I'll be engineer. Then when I entered nursing, then I embraced the love of caring and helping the people. Started my career in like 2 years in the Philippines, and I like ventured to other part of nursing. I joined Saudi Arabia for 3 years in one of the university hospitals. Then I saw how diverse our career can be, being with the multinationality patient that I've cared for. I transferred here to UAE in 2006. Then I am still here, and 15 years in the medical field. Then, as I'm approaching my past mid-age, I realized I think I need to follow my dreams. Since childhood, I dream of seeing the other part of the world. And the best opportunity is, of course, work in the European country. I love to see how you practice nursing. Since I work in Saudi Arabia, we have been studying how you practice nursing. When I was told that there's an opening for your NHS trust, and of course I need to browse in your site, and the first thing I've seen is the patient first policy that you have. And as I always think that that patient could be my mother or my father or any of my relatives. So when you work as a nurse, then you need to work in your full capacity to care for the patients. So I've seen also how you have some programs for the welfare of the staff. Then I would love to experience it more. Yeah, besides the competency, maybe because as you can see, I'm an old nurse already, so I should consider myself to be competent working in the 15 years in medical high dependency. But to top it all, your heart should be in the nursing. Your heart should be speaking of care, compassion, and being kind and understanding to the patients. Not because our patients are really in critical stage before they go to ICU. I always find time to talk to them. And before this pandemic comes, we can touch them with our bare hands. But now, even with our gloves on, a touch makes the biggest difference in our patients' lives. So I think that's the one thing that I can offer. All the nurses that I know, we have all the competencies available. If we need the training, we will have them. But I always tell the junior nurses, put your heart into nursing, put your heart into work, and then the work will be very smooth. And I could say we have the standards or guidelines to be followed. Safe environment for me is not only for the physical attributes of it, but the safe environment for me is where all the staffs are aware of the safety guidelines, any hazardous materials present in the unit and all. Risk assessment should be done in the unit. That's very important. Yearly we're doing that. Also, staff knowledge of any safety concern should always be updated. As we work as a team, we are all responsible to make sure that we are working in a safe environment. And safety issues should always be addressed, either to tell your immediate charge nurse, supervisor, up to the manager. You have your full responsibility to have the better and safe working environment. To make patient surroundings safe is first, our bed should be safe enough where the side rails should be working properly. The patient's bed itself should have an alarm, will be notified when the patient's about to, like, any chance of falling off the bed. If that is not with your bed function, a call bell or a calling mechanism should be available and within the reach of the patient. Safety means all the equipment, especially the electrical equipment, should be updated and checked by our engineering department. All our IV machines, intravenous machines, feeding pumps should be always checked, and that is, I can say, is a part of our nursing task before we even start our duty. Yes, and the patient as well should be well orientated. The moment he steps into the room, he should be orientated on the environmental setup of the room. They will say the mainly responsible person for the patient is the MRP, our most responsible physician. But I, as a staff nurse, has the major or the big part in taking patient responsibility. First is for my patient to be fully assessed of what their needs are. Not only the medical needs, we need to look into their psychological needs, physical needs. Once the patient's need is addressed, and then the work will be very smooth. I am very responsible to get their immediate needs as timely as possible. To be an advocate to my patient is one of my priorities. Maybe because of the experience, I don't take doctor's orders. I should manage them, discuss their management if that is appropriate or matching to my patient needs. I am mainly responsible to educate the patients. We have educators. We have diabetes educator, infection control nurses, but I am the most responsible one. We have the charge planner on the floor, but I am the first one to identify what their needs to help them or to help my patient to be discharged as early as possible once they're more stable. All in all, I am responsible in the holistic needs of my patients. The patient. Preventing the patient falls starts with the first encounter with the patient or with involving their family. Identifying the patient who is at risk of falls should be considered or should be initiated with the fall prevention protocol. And that is first is to identify them in the proper room allocation. If they need to be the nearest in the nursing station where you see them all the time, then that's the first priority. If the patient needs to be in 1:1 nursing, if that is very high risk, then we need to escalate that issue with our management, that if we need a 1:1 nursing, because we want to avoid restraining the patient not to fall. Third one is to review what medication the patient may be having and discuss it with the physician. We have the fall prevention program and we follow the Morse Falls assessment scoring. And that is considering any IV medication, any secondary medical conditions they might have, any of their history of prior falls within 3 months. And in addition, we have presently like alarm boards, posters. We put bracelets to our patients only to alarm the caregivers that whoever will come in contact with the patient, that this patient is high risk of falls. That will be shocking at first, but I need to be calm and really put my critical thinking in place. First is to check my patient. If the patient is safe, patient is stable, after checking the vital signs, then I need to communicate with the doctors together with the charge nurse, because the patient should be seen by the physician in his point of view or recommendation. We need to escalate or immediately inform our nurse manager in line, because the safety concern is happened that the patient unfortunately receive a wrong medication. In part of the process is analyzing the root cause of what happened. And so, of course, as a staff nurse, I'll be expected to be part of this cause analysis and all. It is our responsibility. A physician, me or the nurse manager, can directly speak to the patient. We need to be honest with the patient of what happened. I will not say which nationality. Some may really give more attention to others, and that's just a very sad truth. That should not happen. If a patient comes to me and felt like that, of course, I need to apologize to him and make him feel that I hear his complaints or his concern. Then I need really to make sure that he will feel that we are striving to treat all patients in the same level. And next to that is, of course, I need to raise it up within our colleagues, maybe to make them realize or that we need to stick to our vision of treating patients fairly and all. Some staff I can see, especially the new staff, they might feel like they are treated unfairly sometimes, especially in the patient allocation by the senior staffs. But that is always being resolved during our mini huddles meeting before every duty shift. So we'll make sure we'll give time to even the new staff to speak up of their concern. So speaking up should not be taken against any of our colleagues. When somebody comes to me and they feel like treated unfairly, then that should raise a concern for me.